Hello to all my dear pharmacy aspirants. I am Kishore. I am a pharmacist who can guide you with his experiences in this particular field of pharmacy. And I feel that this is high time to publish this particular video for those persons or those students who are thinking that pharmacy is a good choice for their future. But there is a doubt in their mind that what will be the subjects in this particular study and what will be the future. There is a gloomy idea in their head. So I want to make it very transparent from my experience. Actually, I have worked in the fields where a pharmacist can work, and this is my second video because the same topic I already have discussed in my same means in my own mother tongue language, Bengali, and right now I am making this video for the persons who don't know Bengali. There may be many students who don't know Bengali, so for them I am making this one. So the most important topic and the most basic topic for choosing a subject is to know the scope of that particular subject. And as I know the scope of pharmacy, and as I already have worked in manufacturing industries, drug manufacturing industries, and I know the segments of those industries, as well as right now I am a government pharmacist in state government hospital in West Bengal. So I can tell you the ins and outs of all those things which you should know. And another thing, there is another big sphere of pharmacy, that is marketing sphere, and in that particular aspect also I have many good friends and I know from them closely that particular region, and already I have came to know all those ins and outs of marketing also, as I have worked in industry and I was related to marketing persons. So the subject what you are going to choose, if you choose it blindly, then when you will work on the base of that knowledge which you have gathered in your this particular higher study, then it will be all in vain, because you will not feel the pleasure of working. And if you do not feel that pleasure of work, then just for gaining money to do the work will be a burden to you. So I just want to say you something before I start what are the scope and all of pharmacy. First thing, when you are going to choose any subject or choose one subject, then don't be influenced by any others who don't know regarding the subject properly. Rather, it will be better if you do research on that particular topic and make your own idea and gather the information from such person who have deep knowledge and who already have worked in that particular field. So I want to say that suppose you want to be a computer engineer, so you have to get knowledge from a computer engineer and who is happy computer engineer. Not like that a computer engineer, he used to say that this is a very bad choice for choosing computer engineering and the market strategy is this, you will not be happy anytime, this is the pressure and all time the negative aspects he used to means exaggerate in front of you, then you should not listen to that person. All the subject, even all the things in our world has pros and cons, but the people who are smart, they used to be successful. And the first key of success is to be the particular person who you are. If you are a pharmacist, you have to think that you are a pharmacist and you are proud to be a pharmacist. If you are a doctor, you have to feel that you are a doctor and all the responsibilities which you take, that is very much pleasurable to you. You have to enjoy your job. If you are an artist, see, one artist can never be a good artist if you don't love the art. Means if he is a painter, or if he or she is a singer, then they have to love it. Otherwise the creation will not come. Just like that, everything is a creativity. If you can think like that, then you will grow and you will dash all the obstacles in front of you, and you will be a successful person, and also you will be a happy person. Happiness is a very important thing in job. Otherwise job satisfaction will not come, and you will also means demoralize people. You will become just one demoralizing person and unhappy person, whatever. Now pharmacy scope means mainly whoever have a little bit knowledge, they know that there are about 3 segments: marketing segment, industry segment, and another is as a government pharmacist, and one more segment is there, academics. So except this all 4 segments, there are many other segments where a pharmacist can work, where a pharmacist can get job, but these are the basics. The first segment is marketing section. In marketing section, generally the job is of a medical representative. Who is a medical representative? Who used to work under one medicine manufacturing company, marketing section, and the products he have to sell. How the products used to be sold? As pharma products cannot be given advertisement, so they have to go to the doctors directly, and they have to tell that whatever the benefits of that particular product, and in that they have to describe the form of that product, how much that is absorbable, how much that is soothing, how much that is appealable, and how much is the quality maintenance of that particular company, and all those data will be given to the doctor, and doctor will decide that this product is very much safe and efficacious, and the all aspects, the CSPQ, it is called CSPQ, strength, identity, productivity and quality, all those aspects are very good, then he will prescribe that particular product for a patient. So this is the job of medical representative. But the marketing segment is not only in the periphery of this particular or box of this particular opportunity of medical representative, except that there are many other opportunities in that field also, where you can get one official job also, and where you can be a trainer also. That will be discussed later. Now I am coming to the production or industry section. Production or industry section or manufacturing section is concerned with the manufacturing of the drug products. That is mainly concerned with, or mainly divided into 2 segments. One is API segment, that is active pharmaceutical ingredient segment, where the main drug means the drug molecule is produced from the crude drug or raw drug or a particular molecular intermediate, and after that API is given to the formulation companies, then they make the formulation. What is the formulation? Formulation means, suppose you are taking one tablet, then in that tablet maybe paracetamol 500 mg is there. That means 500 mg paracetamol is consisting in that particular form of the drug, and the drug form is named tablet. but if you weigh that particular tablet, it will be about 1.5 gram weight, suppose. So 500 gram is paracetamol. What are the other things? The other things are called excipients. To give that particular form, the excipients are used, and also we have to see that excipient should not act like a drug, or it should not be a toxic, and it should not have any effect on our pharmacological system. And the formula is a tablet formula. Like that, syrup is there, many other forms are there. Forms also I will discuss later. Topical form, systemic form, means IV intravenous form, and the oral solid dosage form, etc. That will be discussed later. Now in that API company also you can get job, or formulation company also you can get job. Now it is a wise decision that where you should go, that will be discussed later, that where you should go, API company or formulation company, where you should work fast in the beginning of your means career. But right now we are just talking about the scope. So in the scope of industry, there are many segments in the industry. The first and core sub segment is manufacturing portion. In manufacturing portion, the people are called production people, production persons. If you are joining in production, then you have to be a production chemist or junior chemist, like that posts are there. After that, there are different segments also in production, that is in core manufacturing and in packaging, in warehouse, like that segments are there. The next segment is quality control segment. In that particular quality control segment, chemistry honors people also can join, and pharmacist also can join. Chemical engineer people also, sometimes I have seen that they have chemical engineering degree and they have joined in quality control. Microbiology persons, microbiology is a segment of quality control. There they used to absorb microbiology means students also. And the next segment is quality assurance segment. Quality assurance segment, in quality assurance segment, generally any bio graduate like microbiologist or honors in any bio subject can be absorbed, but pharmacists have the highest preference and they can get job in quality assurance also. There are many other segments. In that, R&D, F&D, that means research and development and formulation and development, these segments also are there. AAD, analytical development, like this segments are there. That is also classified under quality control or smaller segments of this bigger window. So but in R&D and F&D, generally master degree is required. So in industry, these are the areas or aspects where you can get job. And now I am telling about the pharmacy. Now I am saying about the pharmacy portion. Pharmacist means who used to deliver medicines in hospitals, but right now the store also is under pharmacists. Means in hospitals the stores are giving to all the ward and other segments of hospital the materials. Mainly all the materials are medical equipments and medical substances and drugs. So only one pharmacist can understand the importance of this equipments and drug substances. So right now pharmacists are getting absorbed in that particular segment of hospitals. Now for government job, this is one segment. Another segment is drug inspector job is there. For that, central drug inspector CDSCO exam is there. Giving that particular exam you can join, that is after 4th year or during the final semester you can prepare for that. Except these all, you can prepare for GRE, TOEFL, like this, IELTS, like this exams, which will be make you eligible to study in abroad with this particular subject. And you can get job also after having few experiences in Indian companies or home companies, and also directly you also can be recruited in Middle East countries, like that. So abroad also you can get jobs. Now, what are the other segments? There are many other segments which I will describe later, like IT. In IT also one segment is there for pharmacists, that is pharmacovigilance, medical writing, clinical data interpretation, etc. And you can do specialization in forensic pharmacy, in community pharmacy, etc. According to that your job will be decided. That is in the master degree. Now I just want to say that how many types of study means how you can study pharmacy. In 3 segments you can study pharmacy, that is diploma course is there, bachelor course is there, B Pharm which is called, and master degree M Pharm is there. Except this D Pharm, or not D Pharm, Pharm D, that is one integrated course, doctorate in pharmacy, that also you can do. And after Pharm D, it is said that it is not that much flourish in our country right now. It is said that they can write the prescription also, they can prescribe medicines to patients also, that is equivalent to MBBS, like that it is said. But I have a little bit gloomy idea. I will research regarding this and I will let you know later, and I will let you know the institutes also where you can get those courses. Okay, that is very few in our country, yet I will research and I will tell you. Right now you can just focus in bachelor degree, whoever got their West Bengal joint entrance rank. And one thing I just want to say, some people used to think that which college will be better, which college will be less than them in performance. Don't think all those things, just think about the economical situation. If you are getting one seat in government college, then definitely you should join there, because economically it is much cheap, and other colleges in other aspect, every college is private colleges, so you have to think the college fee is least, that means it is okay. Otherwise giving more fees, if you are just joining this course and it will take about 4-5 lakhs for 4 years, and after one time you will see that all pharmacists are in same level, except the persons who are smarter than others. Whatever college they have choose, that doesn't matter. How much you have studied, how much you have potency, and how much you have that capacity to withstand in the field. That means how much tolerability is there inside you, that depends how much successful you will be. So always choice the right option, that is, if you get government colleges, if you get seat in the government colleges, don't think, just join, and the course fee will be very less for you. If you don't get it, then select the lowest expense wherever, that is the best college for you. You need the degree, you need one library where the library will supply you books, because books are very costly. So whatever college have libraries, right now whatever college is opening, they have their library, they will provide you book, you can make your notes, you can study, no issue. Just have one library, have one good ambience in that college, and maybe that college is nearer to your home, that will be a good benefit for you. according to those aspects you just think. Don't think that this college is very much flourishing, this persons are saying, he is saying, she is saying. Don't think about that. Think about economy and join. That's all. Best of luck, and I'll be keep uploading all the videos which will be beneficial for you. If you think that these videos are good for you, helpful for you, then subscribe my channel, and you can like, it is your wish. But if you feel it is good for you, then please comment, and I will take your comment as my criticism. If there is anything wrong, then also you can tell me. I will rectify in my next videos. Thank you.